Dizziness is a common sensation that many people experience at some point in their lives. It can feel like lightheadedness, a spinning sensation, or even a sense of unsteadiness. While dizziness is often harmless and temporary, it can sometimes signal a more serious underlying health issue. In this video, we'll explore the most common causes of dizziness, how to recognize when it might be a sign of something serious, and what steps you should take if you experience it. Let's start by understanding what dizziness actually means and how it differs from similar sensations like vertigo or imbalance. Dizziness is a broad term that describes a range of sensations, such as feeling faint, woozy, weak, or unsteady. It's important to distinguish dizziness from vertigo, which is the false sense that you or your surroundings are spinning or moving. Some people may also experience disequilibrium, which is a loss of balance or stability. Understanding these differences can help you better describe your symptoms to a healthcare provider and get the right diagnosis. Let's look at some of the most common causes of dizziness. One of the most common and easily treatable causes of dizziness is dehydration. When your body doesn't have enough fluids, your blood pressure can drop, leading to feelings of lightheadedness or faintness. This often happens after exercise, during hot weather, or if you haven't been drinking enough water. Rehydrating with water or an electrolyte drink usually resolves this type of dizziness quickly. However, if dehydration is severe or accompanied by other symptoms, it's important to seek medical attention. Low blood sugar, or hypoglycemia, is another frequent cause of dizziness. This is especially common in people with diabetes, but it can happen to anyone who hasn't eaten for a while or after intense physical activity. Symptoms may include shakiness, sweating, confusion, and a rapid heartbeat in addition to dizziness. Eating a quick snack, like fruit or granola bar, can help restore blood sugar levels and relieve symptoms. Persistent or severe hypoglycemia should be evaluated by a healthcare professional. The inner ear plays a crucial role in maintaining your balance. Conditions like benign paroxysmal positional vertigo, BPPV, labyrinthitis, or Meniere's disease can disrupt the signals from your inner ear to your brain, causing dizziness or vertigo. These conditions may also cause symptoms like ringing in the ears, hearing loss, or a feeling of fullness in the ear. If you notice these additional symptoms, it's important to consult a healthcare provider for proper diagnosis and treatment. Low blood pressure, also known as hypotension, can cause dizziness, especially when standing up quickly from a sitting or lying position. This is called orthostatic hypotension. It happens because your body can't adjust blood flow to your brain fast enough, leading to a brief drop in blood supply. Staying hydrated, rising slowly, and wearing compression stockings can help manage this condition. If you frequently feel dizzy when standing, it's a good idea to discuss this with your doctor. Certain medications can have dizziness as a side effect. Blood pressure medications, sedatives, antidepressants, and some antibiotics are common culprits. If you've recently started a new medication and noticed dizziness, check the information leaflet and talk to your healthcare provider. Never stop taking a prescribed medication without consulting your doctor, as this can sometimes be dangerous. Adjusting the dose or switching to a different medication may help resolve the issue. Emotional factors like anxiety, panic attacks, or high stress levels can also lead to dizziness. When you're anxious, your body releases stress hormones that can affect your breathing and heart rate, sometimes causing hyperventilation. This can make you feel lightheaded or dizzy. Practicing relaxation techniques, such as deep breathing or mindfulness, can help manage these symptoms. If anxiety-related dizziness is interfering with your daily life, consider seeking support from a mental health professional. Sometimes, dizziness can be a sign of a heart problem. Conditions like arrhythmias, irregular heartbeats, heart failure, or even a heart attack can reduce blood flow to the brain, causing dizziness or fainting. If dizziness is accompanied by chest pain, shortness of breath, palpitations, or fainting, it's important to seek emergency medical attention right away. Early intervention can be life-saving in these situations. Certain neurological conditions can also cause dizziness. Disorders like migraines, multiple sclerosis, or even a stroke can affect the brain's ability to process balance and spatial orientation. Symptoms may include sudden, severe headache, weakness, numbness, difficulty speaking, or vision changes along with dizziness. If you experience these symptoms, especially if they come on suddenly, it's crucial to seek immediate medical attention. Anemia, or a low red blood cell count, can lead to dizziness because your body isn't getting enough oxygen. This can happen due to chronic conditions, poor diet, or sudden blood loss from injury or heavy menstruation. Other symptoms may include fatigue, pale skin, and shortness of breath. If you suspect anemia or have unexplained blood loss, it's important to see a healthcare provider for evaluation and treatment. Various infections, such as the flu, colds, or even COVID-19, can cause dizziness. This is often due to fever, dehydration, or the body's response to fighting off illness. Sometimes, infections can directly affect the inner ear or nervous system, leading to more pronounced dizziness or vertigo. If dizziness occurs with high fever, severe headache, or neck stiffness, seek medical attention as these could be signs of a more serious infection. Problems with your eyesight, such as needing new glasses or having an eye condition, can sometimes make you feel dizzy or off balance. Your eyes play a key role in helping your brain maintain balance, so any disruption can lead to dizziness. If you notice changes in your vision, along with dizziness, schedule an eye exam to rule out any underlying issues. Allergies and sinus congestion can sometimes cause dizziness, especially if your inner ear is affected. Swelling or fluid buildup in the sinuses can put pressure on the inner ear, disrupting your sense of balance. Treating allergies with antihistamines or decongestants may help relieve these symptoms. If dizziness persists, consult your healthcare provider for further evaluation. Motion sickness occurs when your inner ear senses movement that your eyes do not, or vice versa. This mismatch of signals can cause dizziness, nausea, and even vomiting. It's common during car, boat, or plane travel. Remedies include looking at the horizon, using motion sickness bands, or taking over-the-counter medications. If you're prone to motion sickness, planning ahead can help you avoid discomfort. Have you ever stood up too quickly and felt dizzy for a moment? This is called orthostatic hypotension, and it happens when your body can't adjust your blood pressure fast enough. It's usually harmless and lasts only a few seconds. To prevent this, try rising slowly from sitting or lying positions. If this happens frequently or is accompanied by fainting, talk to your doctor. Dizziness is a common symptom during pregnancy, especially in the first trimester. Hormonal changes, lower blood pressure, and increased blood flow demands can all contribute. Most of the time, this type of dizziness is mild and manageable with rest, hydration, and slow movements. However, if dizziness is severe, persistent, or accompanied by other symptoms like bleeding or severe headache, it's important to seek medical advice. Chronic illnesses such as diabetes, thyroid disorders, or autoimmune diseases can sometimes cause dizziness as a symptom. Managing the underlying condition with proper medication and lifestyle changes can help reduce dizziness. If you have a chronic condition and notice new or worsening dizziness, it's important to discuss this with your healthcare provider to rule out complications. Older adults are particularly susceptible to dehydration, which can lead to dizziness and even falls. As we age, our sense of thirst diminishes, and medications may increase fluid loss. Encouraging regular fluid intake and monitoring for signs of dehydration can help prevent dizziness in older adults. If you or a loved one experiences frequent dizziness, consult a healthcare provider for assessment. While most causes of dizziness are not life-threatening, certain symptoms require immediate medical attention. These include sudden severe headache, chest pain, shortness of breath, fainting, weakness or numbness, difficulty speaking, or vision changes. These could indicate a heart attack, stroke, or other serious condition. If you or someone you know experiences these symptoms, call emergency services right away. Vertigo is a specific type of dizziness that feels like you or your surroundings are spinning. It's often caused by inner ear problems, such as BPPV or vestibular neuritis. Vertigo can be very unsettling and may be accompanied by nausea, vomiting, or difficulty walking. Treatment depends on the underlying cause and may include physical therapy, medications, or specific maneuvers performed by a healthcare provider. Disequilibrium refers to a feeling of unsteadiness or imbalance, especially when walking. Unlike vertigo, it doesn't involve a spinning sensation. This can be caused by problems with the inner ear, vision, nerves, or muscles. It's more common in older adults and can increase the risk of falls. Addressing the underlying cause and using assistive devices can help improve stability. Lightheadedness is the sensation that you might faint or pass out. It's often caused by dehydration, low blood sugar, or standing up too quickly. Unlike vertigo, it doesn't involve a spinning feeling. Most cases are mild and resolve quickly, but persistent or severe lightheadedness should be evaluated by a healthcare provider. Your body's balance system is a complex network involving the inner ear, eyes, muscles, joints, and the brain. The inner ear detects motion and changes in position, while your eyes provide visual cues. Muscles and joints send signals about body position, and the brain processes all this information to keep you upright and steady. Disruption in any part of this system can result in dizziness or imbalance. BPPV is one of the most common causes of vertigo. It occurs when tiny calcium crystals in the inner ear become dislodged and move into the ear canals. This disrupts the normal flow of fluid and sends confusing signals to the brain, resulting in brief episodes of spinning, especially with head movements. BPPV is usually not serious and can often be treated with specific head maneuvers performed by a healthcare provider. Labyrinthitis and vestibular neuritis are inner ear infections that can cause sudden, severe dizziness or vertigo. These conditions may also cause hearing loss or ringing in the ears. Symptoms often improve over days to weeks, but some people may need medications or physical therapy to help with recovery. If you experience sudden, severe dizziness with hearing loss, seek medical attention. Meniere's disease is a chronic inner ear disorder that causes episodes of vertigo, hearing loss, ringing in the ears, and a feeling of fullness in the ear. The exact cause is unknown, but it's thought to involve abnormal fluid buildup in the inner ear. Treatment focuses on managing symptoms and may include dietary changes, medications, or in some cases, surgery. Migraines aren't just severe headaches, they can also cause dizziness or vertigo even without head pain. This is called vestibular migraine. Symptoms may include sensitivity to light or sound, visual disturbances, and balance problems. Treatment involves managing migraine triggers and using medications as prescribed by a doctor. Dizziness can sometimes be an early warning sign of a stroke, especially if it comes on suddenly and is accompanied by other symptoms like weakness, numbness, difficulty speaking, or vision changes. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, time to call emergency services. Immediate medical attention is critical for the best outcome. Fainting, or syncope, is a temporary loss of consciousness often preceded by dizziness or lightheadedness. It can be caused by a sudden drop in blood pressure, dehydration, or heart problems. If you faint, it's important to see a doctor to determine the cause, especially if it happens more than once or is associated with other symptoms. Diagnosing the cause of dizziness often starts with a detailed medical history and physical examination. Your doctor may ask about the onset, duration, and triggers of your symptoms, as well as any associated signs like hearing loss or vision changes. Additional tests, such as blood work, hearing tests, or imaging studies, may be needed to pinpoint the cause. Treatment for dizziness depends on the underlying cause. Simple cases may resolve with rest, hydration, or dietary changes. Inner ear problems might require physical therapy or specific maneuvers, while chronic conditions need ongoing management. Always follow your healthcare provider's advice and never self-medicate without guidance. Making certain lifestyle changes can help reduce the frequency and severity of dizziness. These include staying hydrated, eating regular meals, getting enough sleep, managing stress, and avoiding sudden movements. For those with chronic conditions, following prescribed treatment plans and attending regular checkups are essential. Dizziness increases the risk of falls, especially in older adults. To prevent falls, keep living spaces free of clutter, use non-slip mats, install grab bars in bathrooms, and ensure good lighting. Wearing supportive shoes and using assistive devices when needed can also help maintain balance and safety. You should see a doctor if your dizziness is frequent, severe, or accompanied by other symptoms like fainting, chest pain, shortness of breath, or neurological changes. Early evaluation can help identify serious causes and prevent complications. Don't ignore persistent or worsening symptoms. Your health and safety come first. If you experience mild dizziness, try sitting or lying down until it passes. Drink water, eat a light snack, and avoid sudden movements. If you're prone to dizziness, keep a diary of your symptoms to help identify triggers. Remember, self-care is helpful for mild cases, but seek medical advice if symptoms persist or worsen. Proper hydration and balanced nutrition are essential for preventing dizziness. Drink plenty of water throughout the day and eat regular meals that include a variety of nutrients. Avoid skipping meals or consuming excessive caffeine or alcohol, as these can contribute to dehydration and dizziness. Stress management is important for overall health and can help reduce dizziness related to anxiety. Techniques such as deep breathing, meditation, yoga, or talking to a counselor can be effective. Find what works best for you and make it a regular part of your routine. Physical therapy, especially vestibular rehabilitation, can be very helpful for people with dizziness caused by inner ear problems. These exercises are designed to retrain your brain and body to maintain balance. A physical therapist can create a personalized program to address your specific needs and help you regain confidence in your movements. In some cases, medications may be prescribed to help control dizziness or its underlying causes. These can include antihistamines for allergies, anti-nausea drugs, or medications for migraines or blood pressure. Always use medications as directed by your healthcare provider and report any side effects promptly. Keeping a symptom diary can be a valuable tool in identifying patterns and triggers for your dizziness. Note when symptoms occur, their duration, what you were doing, and any associated factors like food, stress, or medications. Share this information with your healthcare provider to aid in diagnosis and treatment planning. If someone you care about experiences frequent dizziness, offer support by helping them stay safe, reminding them to stay hydrated, and encouraging them to seek medical advice if needed. Simple acts like assisting with daily tasks or accompanying them to appointments can make a big difference in their well-being. There are many misconceptions about dizziness, such as believing it's always caused by low blood sugar or that it's a normal part of aging. In reality, dizziness can have many causes, and it's important not to ignore persistent symptoms. Understanding the facts can help you make informed decisions about your health. Dizziness is a common symptom with a wide range of possible causes, from dehydration and low blood sugar to inner ear problems and more serious conditions like heart disease or stroke. Most cases are mild and resolve quickly, but persistent or severe dizziness should always be evaluated by a healthcare professional. Remember to stay hydrated, manage stress, and seek help if you experience concerning symptoms. Thank you for joining us as we explored the causes of dizziness and when it might be serious. Understanding your symptoms and knowing when to seek help can make a significant difference in your health and peace of mind. Stay informed, take care of yourself, and don't hesitate to reach out to a healthcare provider if you have concerns about dizziness.